So this morning I thought, what am I going to talk about? Because we've heard so much about the health stuff and how people die of lung cancer and mesothelioma and asbestos, etc. And I was thinking back to when I was a nurse, and yeah, I was a nurse. I was a deep, caring, meaningful person. And then I came and worked for Worksafe. So, it's quite a good contrast, really, all cool. And in the 90s, I worked in oncology for a couple of years, and haematology, which was leukemia and cancer wards. And it sounds like, oh God, who'd want to work there? But it was probably my best nursing experience, to be honest, because I think to help people die with dignity is a huge thing to be able to do. And I guess what I want to say from that is I don't want to see any of you in those wards in 20 years' time. And my worry is that some people will be. They'll be in those oncology wards and they'll be dying of lung cancer and they'll be dying of mesothelioma. And I'll tell you what, I've seen a lot of people die of lung cancer. Helen Kelly, who never smoked, was never exposed to dust that we know of, she died from it. It's a shitty, shitty way to go. And I think we get a bit blasé about asbestos, we get a bit blasé about dust out there in the construction sector. We see it as just part of everyday work. Well, it kills people, bottom line. Not just asbestos, all dust potentially can kill you, can make you sick. So don't end up in those cancer wards. Look after your workers. And I just can't say that enough. And I know that people think, it's not going to happen to me, and it doesn't happen for 20 years, 30 years. Yeah, well, okay, maybe it doesn't happen for 20 years. But who wants to be 60 with lungs that they can't breathe with? Nobody, do they? So you look after yourself. It's just really important. Now, I don't know you don't want to hear me bang on forever. So I've got a YouTube video, not of me, rest assured, of an English man who suffered from mesothelioma. And I just thought it was a really interesting one. And do you want to play that for me, Jared? That'd be cool.
Well, most of us, I think those who perhaps who came up through the industry as I did as an electrical apprentice before, having your own business, the chances are you would have come in contact with asbestos sometime during your career, to some degree.
Working career.
Well, when I started life as an apprentice electrician, at that moment of time the company were doing a lot of work in schools, and we were working in boiler houses and cable ducts where there were laggers lagging the pipes and the boilers with asbestos. And I used to be quite fascinated standing there watching them, not realising at the time, of course, floating around in the air were all these asbestos fibres, having no awareness at all that later on in life they would catch me up and could give you a disease.
Okay.
I mean, the first time it really came home to me was when I was away on holiday in Cyprus, and I was finding that just to climb the stairs to go to the restaurant or to walk more than 100 yards, 150 yards, I was gasping for air. And whereas normally I'm quite active on holiday, walking the promenade and the like, there was an awful lot of sitting around and lying on the bed because I couldn't manage it. So as soon as we got back from holiday, I went straight to my GP on a Monday. He arranged for me to have an x-ray, which luckily at our local hospital they did that day. And then I heard on the Wednesday a call back from my GP to say that I was ticking lots of boxes that I should be seen as a matter of urgency within 10 days. But being a member of the UCA and the JRB, I've got BUPA cover. I said leave it to me and I'll arrange to see if I can get anything quicker. And I arranged to get in to see a consultant on Friday evening. And having seen him and him giving me an x-ray, he wanted me in straight away, and he made special arrangements for me to be admitted to the hospital on Sunday. So from seeing my GP on the Monday, on the Sunday I was in hospital and they were beginning to take samples of the fluid that was around my lung. And then we found 2 weeks later I was called up to see my thoracic surgeon, who very gently informed me that she thought I had years to live rather than decades because I got mesothelioma, asbestosis, which was our worst. It was always there in the background, but like everything, you never think it's going to be, never going to be you, and it was the worst news one could have heard. But the day after I had been given the news that I'd got this disease, I went to see my local GP because he's had experience of people with this disease, and I asked him what his experience of it was, and he said out of the something 40 odd patients he had, they'd survived anything between 4 months and 4 years from diagnosis. So I did ask him what's the difference between those who survived the 4 months and those who survived the 4 years, and he said it was generally your state of health at the time. You know, I was a smoker, but I'd stopped smoking 40 years ago. I do drink, but you know, I think in moderation, and have quite a healthy lifestyle. And he looked at me and he said, well, he said, you look like a butcher's dog. He said, I think you'll do better than most. But a big part of it was to have a healthy, going into the treatment with a healthy lifestyle gave you more chance of a longer survival. The first thing you're going to get used to is that it isn't curable. They do tell you enough times, you know, I'm sorry, but we can't cure this. You know, I'm receiving treatment. I've had surgery, radiotherapy, now receiving chemotherapy. Everything they're doing, in a sense, is palliative. So my surgeon did turn around to me and say, you've got to do some forward planning. You know, you've got to plan for the end of your life, and I'm not sure whether that's a good thing or not. But it's a whole thing, just making out a will that covers your ordinary house and chattels. I want to make sure my wife is going to be able to remain in the house where we live at present, because we love it, it's our home. And I've got a business which I've got to sort out succession planning for. I was beginning to make plans, but I thought I had years in which to get it all sorted, and suddenly the timescale's been shortened, and even if it's down to things like inheritance tax, all things like that suddenly become more important to you as you get closer to this point. Well, I've been very fortunate that my daughter came to work for me 7 or 8 years ago, so the expectation is that she will come in and take the business over. I have another son who works in the business, and I think he will play a part in it, and we hope the business will and the name will carry on for another generation. The industry does an awful lot to train its apprentices and bring them the awareness of asbestosis and the dangers. And I think as soon as you get signs of coughing or breathlessness, you should go to your GP and tell him that you've had contact with asbestos in the past, in the hope that they may be able to diagnose it earlier rather than later. I think some people may take it a bit lightly and they say perhaps all these procedures are not, all these precautions are not really necessary. I must admit I was one of those that perhaps might have thought, well, you know, can I just drill a hole through an asbestos tile? You know, do I need to worry about it? But when something like this happens, you are acutely aware that yes, they're with asbestos, and there's still an awful lot of it still around. It is one of these substances that has this effect of this disease.
Cool. That gentleman died 2 months after he made that video. So he actually only survived about 6 months from diagnosis. So that's what happens. I think it's just to bring it down to earth, and if you do want to, you know, try and share some information with your staff, there is some good information around, and that was simply a YouTube video, so I thought that was really useful. I want to talk a bit about some of the health monitoring that's required as well. So look, I think, you know, we get quite good, we get our work plans in place, we plan our work, we do a bit of sampling, make sure we train our staff, and then we forget to do health monitoring. And I've been knocking around for about 20 odd years in this space, and the thing I talk to companies about the most that they're still not doing is health monitoring. And it's not just in relation to asbestos, it's across the board. But I think it's getting better, Ingrid. You're noticing a bit of increased uptake, aren't you? We've got some providers on the room, which is great. You are getting the message, admittedly notices from my wonderful, and not my inspectors, but the wonderful inspectors we have. Oh, my bloody inspectors, crikey. They have been brilliant working in this space, getting alongside businesses to get businesses on doing some health monitoring. So, you know, well done to those inspectors. It's been really good work. Look, there's plenty of legislation out there in relation to asbestos. The Act, obviously, Section 36, that overrides everything. You go straight back to the Act, regardless of what else sits there. So there is a requirement under Section 36 of the Act that if you expose your workers to health risks, you have to do some monitoring. Okay, so it's quite clear there. Then you've got the regulations that came out this year for asbestos, which are much more specific. So Regulation 15 and 16 both relate to health monitoring. So it's called out there. Remember, the regulations are a legal document. They stand up in court. We've also got the General Risk and Workplace Management Regulations, and there's some information in there as well. But if you look at the regs, they'll be the most applicable for you. The best document, if you want to get clarity around what's required, which I will go through, is the approved code of practice that Rob was waving around before. It's really good, actually. It puts it really clearly about what's required in the health space. I don't really see how you could get muddled, but I'm sure some people will manage to muddle it. Good luck with that. And try and say that they don't need health monitoring. I'd challenge, if you're working in this space, that you don't need health monitoring. It's pretty clearly laid out. So have a look at that. But I'll run it through you anyway. So who does it apply to? Basically all the people that Rob was talking about before, your Class A, your Class B, asbestos removal people, licensed asbestos assessor work, and any workers carrying out ongoing asbestos related work or unlicensed work, anywhere where there's a risk of airborne exposure to asbestos. Okay, who's doing health monitoring in this space? Yep, cool. People are usually too scared to put their hand up because I think people are a bit scared of me, but my bark is far worse than my bite, I can assure you of that. So I've just noted who doesn't do it. I've got quite a good brain actually, so I'm quite quick. So I've just noted that down. Then I'll be seeing you as you leave the room, so watch out. If you've got any questions though, come up and ask either in the Q&A session or nab me or one of the inspectors at the end, and we're really happy to point you in the right direction. Cool. Okay, so when do you do it? You have to start it within 4 weeks of that worker starting to carry out the work. So don't leave it for ages. Is that what you're saying, Ingrid? What are you saying out there? Exactly. That's the key, is get that baseline, because if you don't have the baseline information about where that person's health status is and their lung condition, you don't have anything to compare it to. So it's really important to get that. So within 4 weeks, okay? So some of you are probably well out of that, but that's okay. And it's good to do it now. So, this is something you probably need to get thinking about and get cracking with it, basically. Okay, so look, it's a full asbestos medical, and this is what it has to include. So it's a physical examination with a lung function test. A good history is really, really important. And trying to get information about that worker's exposure as to have they ever been exposed to it before, any worker exposure monitoring that's been done, any monitoring of the air, any investigations. So the people who do these medicals, it is very, very thorough, really important. And then keep doing it every year. One thing I noticed with industry, sometimes you're quite good at doing the baseline stuff, and like how often our inspectors have to issue a notice for baseline and then for annual health monitoring programs. But you're quite good, some companies are quite good at not keeping on going. And I know one of the inspectors I was talking to the other day said he'd been out to a company, he said, I'm really annoyed. He said, I went there about 18 months ago, 2 years ago, and they did their health monitoring then, and I issued them a notice for an annual program. And I went back and they said, what do you mean we have to do it every year? We just did it once. And I think that's fairly common, unfortunately, in the industry. So it is an annual program for the large majority of health risks that our workers are exposed to, it's particularly in the construction sector. So yeah, make sure you do that. Okay, so this is what it basically says, that years after you start employment with the PCBU, for all those years, you've got to have a full asbestos medical, okay? So it goes on for a long time. As we know, asbestosis, mesothelioma, they have a long latency period, but you can definitely be symptomatic in that period of time lead before the disease actually shows. And although those diseases aren't curable, you can actually start to treat those symptoms that are there. That is really important. So, and early detection makes a huge difference with all disease, but in particular with your lung cancers. It is really, really important. So you don't have to get sick, and I think it's really important that we do keep on looking after our workers, get the health medicals done, get those checks done. There's providers in the room who can talk to you about that, find out who does it. And let's hope that in 20 years' time, we don't see a peak of asbestosis and mesothelioma from Canterbury construction workers. Because that's a concern, isn't it? It could happen. Remember the first couple of years post-earthquake? We were all a bit variable in our work practices. Some were good, some were very, very dodgy. And a lot of those dodgy players aren't around anymore, thank goodness. But so let's hope we don't see that happening. And in the meantime, look after your workers, get their health monitored. It is a legal requirement. I'm not standing up here making this up. It is a legal requirement that you must do. So have a look at that stuff in the Code of Practice. And that'd be cool. I thought I had more slides, but hey, someone's cut me off, so that's always good, isn't it? So, cool. And there's lots of resources out there. As Rob said, Worksafe has got a lot. Also, if you go onto the Safety Charter, a number of you are members of the Charter. There's a great way to get information, support, resourcing, mentoring. There's lots of information there. If you're not a member, join up. It's free for small companies. Good information there. And Asbestos Aware is a site that has been designed primarily for homeowners because they've been really worried over the last few years since the rebuild. There's been a lot of scaremongering going on out there for them. I mean, it's been pretty hard, I think, for them. So some good information there. So have a look at the resources, point people in the right direction. That'd be great. There you go. That's me.